Actually, this was a unique analysis we have done with the Princess Máxima Center in Utrecht and UCSF in California. Over the last decade, I would say, we have collected lavages, BALs, from all the patients going into allogeneic transplants in the Princess Máxima Center. And because we were interested, based on previous analysis, what the influence of the microbiome was on the outcomes after. Because previously we were able to find that the presence of respiratory viruses was associated with alloreactive lung diseases. So that's BOS and IPS. So that's GVHD syndromes of the lung. And to dive a little deeper, we did these microbiome and also, let's say, transcriptomic analysis to see whether we were able to identify microbial clusters and how they would relate to RNA expression, human RNA expression in the lungs. What we found was that we were able to identify 4 different microbial clusters. 2 of these clusters, which was the viral predominance, as well as the microbial depleted cluster. These 2 clusters were associated with an increased incidence of these alloreactive lung diseases. And of course, and this is all pre-transplant. So these BALs were done about 2 weeks before, 10 days before they were, let's say, transplanted. And looking at the RNA sequencing, in these 2 clusters, we were also able to identify that there was an upregulation of, let's say, RNA associated with inflammation. So apparently these 2 microbial clusters were associated with an inflammatory environment in the lung, which is later on, weeks to months after, associated with an increased incidence in development of these alloreactive lung syndromes. What can we do with this? Of course, this is all pretty early, but potentially knowing this before transplant, you could potentially intervene and try to get to a better microbial milieu, in the lung early after, let's say, transplant. Or you can intervene earlier when there is a suspicion of development of an alloreactive lung syndrome, because you know that these patients are at risk, so you can intervene earlier. So we hope in the upcoming years to learn more about these analysis, and hopefully we can make ultimately the transplant safer by being able to identify the various patients at risk. So that's interesting and fascinating, of course, how to do that. But you can think of, for instance, having probiotic aerosols or sprays to try to intervene or change the microbiome in the lungs. So it's not pills. You would like, let's say, changing the microbiome in, let's say, the gut. So you need to try to reach all lung lobes. So this is just a wild thought. So maybe you can come up with a spray or an aerosol which, let's say, contains probiotic